Okay, for this video we're going to look at the bones of the shoulder joint, and in particular we're going to focus on two bones, the relatively complicated scapula and the far less complicated clavicle. The clavicle has 2 points here, points of articulation. Medially, the clavicle articulates with the sternum here, and this is the manubrium of the sternum, where the area that I'm circling right now, that's where the manubrium will be. And then there's the acromion end, and the acromion end of the clavicle articulates with the acromion process of the scapula. So there's two ends on the clavicle and the clavicle, so the clavicle is relatively simple. This scapula has two processes. There's the acromion process, which is superior to this and pointing anteriorly, so that's superior portion of the process. And the coracoid process, which is inferior. So there's superior is the acromion, coracoid is inferior. The acromion and the coracoid form a shallow depression here along somewhat with the clavicle. That shallow depression is known as the glenoid cavity. That point of articulation then is formed with the humerus, and that's the shoulder joint. This is an anterior view of the scapula, and then if you go further, closer to the left scapula, you have the subscapular fossa. The subscapular fossa is the fossa or the shallow indentation on the anterior surface of the scapula. You know that this is the anterior surface of the scapula because it's shallow and flat. Okay, so there's no indentations or anything or depressions. Okay, that is the scapula, the posterior portion of the the anterior portion of the scapula. Now, if you look at the posterior portion of the scapula, as we're rotating it further, first thing that comes into play is the spine of the scapula. This is the scapular spine. The spine of the scapula reaches out and forms the acromion process that I mentioned previously. The spine of the scapula, if you see any type of things jutting out on this flat surface, you immediately know that that's the posterior surface. Relative to the spine here, you have the supraspinous fossa and the infraspinous fossa. Supra indicating above and infra below. The last thing about the scapula is that the border that I'm marking right here, this is the medial edge of the medial border of the scapula. This is always medial, and so this is always going to be closer to the midline. This process right here is always going to be superior, and then this angle right here is going to be inferior. The reason that I'm bringing this up is that when you see this in laboratory, you see a lone scapula, and I'll show you what it looks like without any bones. That lone scapula, you're going to be asked to identify it without any other bones. So there's going to be no clavicles, there's going to be no other bones associated with it. And so this is the view that you're going to see. Whenever you see this scapula right here, you know that this is the posterior portion, this is the superior portion, therefore this has to be the left-hand side. If you go over to the other scapula, we're going to take the bones of the right arm out. I'm going to take the right humerus. We've already taken the right ulna. And let me see here, the articular cartilage. So we have all of the bones of the shoulder. Now this is the right scapula. Here's the spinous process. The scapular spine, actually, I'm sorry. The scapular spine posteriorly. This is the supraspinous fossa. This is the infraspinous fossa. The glenoid cavity. The glenoid cavity has to be lateral in the scapula. If it's not lateral, then it's going to have your arm is going to have trouble articulating it. So the left-hand side, the left-hand scapula, and the right hand scapula that I just marked in yellow here. And that's where I want to stop.